Something that may sound far away, but is actually very important for all of us. Outbreaks of dangerous infectious diseases like Ebola, Lassa fever, and Marburg virus. These diseases are rare, but when they do happen, they can spread quickly and cause serious harm. That's why we need to stay prepared, not just in Africa, where many of these outbreaks begin, but here in the United States as well. Right now, there's an active Ebola outbreak in the Democratic Republic of Congo, or the DRC. As of September 4th, there have been 28 suspected cases and 15 deaths in the Kasai province. Sadly, 4 of those cases were healthcare workers who were trying to care for others. Lab testing has confirmed that this is the Zaire strain of Ebola, which is one of the most deadly. Health experts call this area a hot zone. That means it's a place where dangerous pathogens are spreading, creating what we call a high-consequence infectious disease outbreak, or HCID. In simple terms, it's a serious outbreak of a disease that's hard to stop and that requires a fast, coordinated response. The Africa Centers for Disease Control and Prevention, led by Dr. Jean Kasia, is already working with the DRC government to fight this outbreak. They're protecting communities, supporting health workers on the front lines, and coordinating an urgent response. Now, you might be wondering, if Ebola is happening in Africa, why should we care here in the US? The truth is, in today's connected world, diseases don't stay in one place. Air travel and global movement mean that an outbreak in one country can quickly become a threat anywhere. That's why we've learned that we must always be ready, no matter where we live. The United States has built a preparedness plan to deal with outbreaks like Ebola. The federal government, working with state and local partners, has created regional strategies to make sure we're ready. One part of this plan is a network of specialized medical centers across the country. These are hospitals trained and equipped to safely transport and treat patients with high-consequence infectious diseases. For example, at the University of North Carolina, there's a center called the Special Pathogens Response Center, or SPARC. It's one of 13 facilities nationwide that are prepared to handle these kinds of cases. Centers like SPARC don't work alone. They partner with local hospitals to train healthcare workers, share expertise, and make sure everyone knows what to do if a case appears. Training is a big part of this preparation. Health workers practice how to quarantine patients safely, how to protect the public, and how to continue normal health care while responding to a crisis. This year, the U.S. Department of Health and Human Services even ran national exercises to test our readiness for these threats. The program is called Tranquil Passport. It helps hospitals, airports, and public health officials practice how to respond if a dangerous disease shows up here, especially with big public events on the horizon like the FIFA World Cup next year. At UNC, Doctors William Fisher and David Wall led their own Tranquil Passport exercise. Both of them have worked in Africa during Ebola and Lassa fever outbreaks. They've set up treatment units in the field and cared for patients in very difficult conditions. Their experience overseas has directly improved how North Carolina and the whole country prepares for emerging pathogens. Dr. Fisher explained something important. He said outbreaks are not impossible to handle, but they are complicated. The biggest challenge is the unknown. Many of these diseases start with vague, nonspecific symptoms like fever or fatigue. That makes it hard to know right away what you're dealing with. Identifying the outbreak, diagnosing patients, and setting up a coordinated response, all while keeping basic health services going, is a huge task. He described what he calls pillars of response. These include * diagnostic testing to quickly identify cases, * case management, meaning the safe treatment of patients, * infection prevention and control, to stop the disease from spreading further, * epidemiology and outbreak analysis, to track how the disease is moving, * and community engagement, which means working with local people so they understand what's happening and how to stay safe. Dr. Wall also pointed out that outbreaks in Africa and outbreaks in Western countries look very different. In Africa, many areas don't have strong health systems, lab testing, or even basic medical supplies. That makes responding to an outbreak much harder. But even in the U.S., with our advanced hospitals and equipment, we still face challenges. The Ebola outbreak in West Africa from 2014 to 2016, which infected more than 28,000 people, showed us our weaknesses. We had great tools, ventilators, dialysis machines for fluids, and skilled doctors, but coordination was still tough. One other key point both doctors raised is trust. Public trust can make or break an outbreak response. People need to believe the information they're being given. They need to trust health workers, follow safety advice, and feel confident that the system is there to protect them. Without that, fear and misinformation can spread faster than the disease itself. So what can we take away from all this? First, outbreaks like Ebola are not just their problem overseas. They are a global problem, and we all have a role to play in staying ready. Second, preparation works. Training, planning, and coordination make a real difference. And finally, trust is just as important as medicine. We need strong, honest communication with communities, whether here in the US or anywhere in the world. In closing, I want us to remember that outbreaks can happen anytime and anywhere. But if we stay prepared, stay coordinated, and stay connected with our communities, we can meet these challenges head-on.